Welcome back, everyone. My name is Patrick Miller, physical therapist with the Total Joint Rehab in Homewood, Alabama. During this installment, we'll be going over some exercises you can do both before and after the surgery, which will be really helpful in getting that blood flowing, getting those joints moving, and ultimately getting you stronger. Okay, guys, so trying a few exercises before the surgery, and we're talking anywhere from a few days of doing these exercises to up to 12 weeks of doing these exercises a few times a week. Sometimes people do it up to 5 times a week of strengthening balance exercises, core strengthening exercises, and even upper body exercises can really be helpful for strengthening you up prior to the surgery. And again, that can help improve your motion, reduce your pain, reduce the time you spend in the hospital, and improve your strength significantly after surgery, which will help improve your function. So a few different exercises you could try. To start with, I like to do heel raises, simply going up and down on your toes. You know, if you're standing in front of a counter, you can have somewhere to rest your hands. I would typically recommend 10 to 20 of them or so for a few sets, 1, 2, 3 sets, something like that. Whatever feels good for you. That can be really good for strengthening up your calf muscles, which are important for when you're walking around. Other exercises you can do just prior to your hip or knee replacement is mini squats and hip kicks to the side or hip abductions. You can do these prior to both surgeries. Certainly some physical therapists might want you to be a little bit more careful or considerate of some of them right after the surgery, however. First one, if we do mini squats, again, putting your hands on the counter just for safety. You might want to consider putting your feet about shoulder width apart, driving your weight through the heels, and just doing a mini squat backwards, pushing up and then back down again. Really good for strengthening up the thigh muscles, your gluteal muscles, keeping you a little bit more mobile, agile. Ultimately, that will help strengthening up your legs for doing things like standing up, from your bed, standing up from your chair immediately after the surgery. I would recommend somewhere between 10 and 20 repetitions. It might be slightly painful for you prior to the surgery if you have more significant osteoarthritis. So do what you can to keep it within a pain-controlled range of motion during that. Another exercise you could certainly try is kicking your hips out to the side while holding onto a counter. So with your hands on the counter, simply kick your leg out to the side and back in, out to the side, back in. You could do that on the right and the left side, just to kind of strengthen up both hips. Again, try to stand nice and tall, controlled at the trunk when you're kicking your legs out to the side. So you could do 2 rounds of 10 or so of that as well for more of specific hip strengthening. It also works on your balance a little bit too if you're standing on that affected side. Now, potentially a slightly more advanced exercise you could do, which I think is really great for strengthening prior to the surgery. Again, either for knee or hip replacements. Keep it within a pain-controlled range of motion. See how you feel, play around with it a little bit. Is something called mini lunges. You could kick your affected side out and your unaffected side backwards. Again, you could put your hand on the counter, you could be facing the counter, or I like going to the side a little bit more. And what you're doing is just diving your back knee back a little bit and bending your front knee, kind of like that, and then pushing up. And it's more of a way to kind of focus on strengthening that leg that's in front. So in this case, I'm strengthening my right side a little bit more. You could do rounds of 10, again, 2 rounds of 10, whatever feels good to you. For a few rounds within that pain-controlled range of motion. After you do one side, you could certainly try to switch to the other side, bend that knee down, push up. A common compensatory mechanism, what people do, that they're kind of cheating a little bit, is when they're going down, they're leaning forward quite a bit at their trunk. So really focus on driving the back foot down, bending that knee, and then pushing back up again. You could also do some balance exercises prior to the surgery as well. Really good for reducing your falls risk before the surgery, and it actually helps increase your strength a little bit after the surgery as well. So something you might want to consider adding to your program during your prehabilitation journey. So one exercise I really like doing prior to the surgery is something called a tandem stance or a tandem walk. Basically what you're going to do is you're going to put one foot right in front of the other, like a heel to toe, and basically just stand right by a counter with one hand kind of close to something you can grab onto if needed, but generally try to balance in this position. nice and tall, squeeze your abdominal muscles together, and just try to stand in that position just to work on your balance. Something potentially a little bit more advanced, and again, make sure you have a counter or a railing next to you just for support if you need it to reduce your risk of falling, is to put one foot in front of the other and do kind of a tandem walk. So again, heel to toe. That way you can go ahead and work on your balance a little bit more dynamically. I think potentially a little bit more challenging for balance training, again, prior to your surgery, would be something called single leg balance, which is exactly what it sounds like. It's just standing on one leg. Again, having a railing or a counter close to you would be really, really helpful. And if I'm getting my right knee, for instance, done, if I'm getting a total knee replacement on my right side, I might want to have a few fingertips close to a railing, slight bend in my knee, and just kind of stand on that leg. You could hold it whatever feels comfortable for you. Sometimes people are only able to hold it a second or two. Sometimes people are able to hold it up to 30 seconds. So I typically, if they can do it, hold it, 3 times 30-second hold. If the pain is well controlled, you could only do, say you can only do 10 seconds, so maybe try 5 repetitions or something of that. You could do that once a day. Just make sure it's not causing too much pain to the hip or the knee. And you could certainly try on the other side as well, just to even yourself out a little bit. If you're thinking after the surgery while you're walking, you're certainly going to need some of that balance, you're going to need some of that strength. Prior to the surgery, you want to prevent yourself from falling as well, just to prevent any unnecessary complications that may arise. Again, make sure there's a counter or something next to you so you have something to grab onto. You don't want to lose your balance and fall. Okay, so we'll start with some very easy exercises that you certainly could practice before your surgery, but are really going to be your bread and butter techniques immediately after that surgery. It could help get your muscles working a little bit better, help your blood flow, and work on your strength a little bit, we would say. So first one, all you got to do is when you're lying down, focus on squeezing your butt together, squeeze those gluteal muscles, hold it for about 5 seconds or so, and relax. Can't really see it that well on video, but I'm sure you understand the concept. Another one that's kind of similar to that is something we call quad sets. Similarly, you're going to try to activate this muscle in front of your leg. So if my right leg was the surgical side, you really try to flatten your knee against the table, squeeze that muscle in, hold for about 5 seconds or so, and then relax. You can try maybe a set of 10 of those or so, see how that feels, and you could certainly do that a few times during the day. Another really good couple exercises you could do right after surgery, so we're talking within the first few days after surgery, is something called ankle pumps and heel slides, and these are good for both hip and knee replacements. So, as we mentioned in a previous video, you are certainly more likely to develop a DVT, a deep vein thrombosis, or blood clots in your legs. So doing things called ankle pumps can be really helpful for getting the blood moving in the leg to help reduce the likelihood that you're going to get that. These are something you could do multiple times during the day. I would recommend doing at least 20 repetitions a few times during the day. If you're watching TV, do it every commercial break. It's not going to hurt you to do it that much. You could do it lying down, you could do it sitting down, but ultimately it's just getting your ankles moving. Demonstrating lying down, all you have to do is point your toes down and up, really just kind of getting the blood flowing in the lower leg. It's a really, really great exercise to do right after surgery. You can practice it beforehand, certainly, but I would want you to primarily focus on that after surgery. The next exercise you could really do that would be really helpful for your range of motion, again, you could do this for the hip and the knee, is something called heel slides. So if we're pretending that my right leg is the surgical side, what you could do while lying down, typically you would do this without your shoes on, and you might want to have a towel or something underneath your heel. And sometimes people will have like a belt or a towel that they can hold on to help with this, that you would wrap around your foot. But you essentially would slide your heel towards your butt and then back out again. And ultimately, that's a way to get some good motion in your knee and your hip joint right after the surgery, just to kind of keep you a little bit more mobile. Again, typically you wouldn't have shoes on. You might have a towel under your heel to allow yourself to slide a little bit better. And you could put a belt around your ankle or a towel, like a longer towel, to use your arms to help assist that motion up to your comfort and then back out again. You could do reps of 10 to 20 of those. Do them a few times a day as well. I usually recommend at least 2 to 3 times during the day, just to kind of keep yourself a little bit more mobile. An easy exercise you could do prior to surgery and after the surgery is something called long arc quads, or just knee extensions, knee kickouts. It goes by a few different names. All you have to do is, while you're sitting down, just kick your knee straight up and back down, straight up and back down. Do the best you can. You could do multiple rounds of this, 20 to 30 reps if you want to, for a few different sets. Easy to do, really good at strengthening the muscles of your thigh. It's more of an intermediary exercise, I would say. Easy to do, certainly before the surgery, to help get you strong in the quadriceps and in the thigh muscles. And then after the surgery, you could try it after the surgery. It might be a little bit tough, particularly after a knee replacement within the first few days, but you could certainly introduce it to your program after those first few days, I would say. You may want to consider adding in some upper body exercises after the surgery as well. As you're not going to be able to use your leg as well as before, sometimes you need to rely on other muscle groups to kind of help you along, be a little bit more mobile. One thing I like doing is strengthening my triceps a little bit, both to help push off of your couch, push off of a chair, push off of a bed, and help support you while you're using a walker and walking throughout the day. So you could do something called chair dips to help strengthen those muscle groups. Simply, if you have a chair with hand rests on them, you can push off of the hand rests up and down, just like that, to strengthen your upper body. I like to do 10 to 20 repetitions with those as well. You could do a few sets, really to strengthen your upper arms a little bit for helping supporting you throughout the day. You may want to consider adding in some trunk exercises to your prehab program. A really good one you could do that's really simple and everyone's heard about it before is a crunch. Work your abdominal muscles, really important to help get out of bed, get out of a chair, and even in and out of a car. You've probably seen it a billion times before. Lying down on your back, slight bend in your knees. You could cross your arms across your chest, lift your head and shoulders off the table, and then back down. Same thing, maybe try 10 to 20 repetitions of those, really working on your core muscles, which could help sit yourself up, get yourself out of bed, for instance. Thanks everyone for tuning in. If you like this content, make sure to like and subscribe on YouTube. Once again, my name is Patrick Miller with the Total Joint here in Homewood, Alabama. So if you're in the area, feel free to stop on by and say hi.